Hi Dan, I'm Russell McCluskey. I'm going to be your physical therapist today, and we're going to do the Astrand cycle test.
Okay.
You can go ahead and start the warm up. The reason of this test is based on the results of this, I can use your submax VO2 to calculate your VO2 max, which I can then use to accurately prescribe safe exercise that's specific to you.
Okay.
So prior to this test, I measured the height of this seat according to your greater trochanter height.
Mm-hmm.
And so as of right now, does that seat feel okay? Is it comfortable and whatnot?
Yeah.
Okay. Mm-hmm. In addition to that, I've also taken your resting vitals. Your resting heart rate was at 68. Systolic blood pressure was at 120. Diastolic at 70. So that's all normal and it checks out. In addition, I also did a risk stratification on you, and you have 0 risk factors. And that's based on that you don't smoke, you have no family history of any CBD, you yourself are pretty active, and your BMI, everything checks out. So as a result, I've determined that this test is safe for you to participate in.
Cool. So
throughout the duration of this, I'm going to have you warm up for 2 minutes at 25 watts. And the reason why it's at 25 watts, I'd normally have you at 0 to get you warmed up, but this cycling machine, the lowest it goes is 25 watts. So that's what we're going to have you at. And another thing to focus on is the RPMs. I want you to do that at 50 for the entire duration of this program, even when I up the workload. And so after this 2-minute warm-up, I'm going to up that workload to 150 watts, and that's going to be based on the ACSM guidelines for a conditioned male, and that's what they recommend to jump you up to try to get you in your submax range. And I've calculated your submax range to be between 115 and 163 beats per minute. The goal after I jump up the workload is for your heart rate to be within that range, and if it is, then I'll proceed at that same workload for another 4 minutes. Alright, now I'm going to jump up the workload. Warm-up's over. Okay, now that I've jumped up the workload, it's important for me to let you know that if for any reason during this test you just feel like you want to stop, whether it's getting too hard, for any reason, just let me know and we'll stop it. Another reason why I always stop is if I see adverse symptoms. If I see you breathing too hard, you complain of chest pain. And in addition to that, if your heart rate does reach your 85% max, which I probably do 163, if it reaches that or goes above it, then I'll also terminate this test. So keep me updated throughout the duration of this so I can be confident that we're proceeding safely.
Great.
Okay, so in a minute here, I'm going to take your vitals again. And with those vitals, I'm going to make sure that your heart rate, if it's within your submax range, which I already said was 115 to 163, then we'll continue with this workload. Is everything still going all right?
Yeah.
You okay?
Good.
Alright, I'm going to go ahead and take your heart rate. Your heart rate jumping up to 140. That's a normal response to exercise. Now I'm going to take your blood pressure. Okay, everything's normal there as well. And since your heart rate is within your submax, I got it at 140. Your submax range is 115 to 163. We're going to continue with this workload. At this point, I'm still going to do your oxygen saturation and your RPE. At At this point, what would you say your RPE is based on this scale?
13.
About a 13. Mm-hmm. Oxygen saturation at 97%. That's great. So we're going to continue at this same intensity for 3 minutes, and you've already done that for one more. So in 2 more minutes, I'm going to redo that same test. And after I do that next test, I'm going to do it again right after that to see if you've reached steady state, your heart rate. And if that's occurred, then we can terminate this test. Mm-hmm. You all right?
Yep.
Good. All right, just one more minute here, and then I'm going to go through those same measurements again.
Okay.
So doing all right? Not going to die on me?
No, I'm doing okay.
All right. Okay, I'm going to go ahead and take your heart rate once again.
Okay.
Yeah. 144. Blood pressure. Okay, great. Now, once again, with the oxygen saturation and also your RPE. At this point, what would you say your RPE is at?
Maybe 14.
14. Oxygen at 96%, as well normal responses. I'm going to go through these measurements one more time. Okay, your heart rate's at 148. We've reached steady state, so we can terminate this test after I finish up with these measurements. And one last time with the oxygen saturation, RPE. 14 still, good. And oxygen still at 96%, perfect. Okay, Dan, since you've reached steady state, we can go ahead and terminate this test. I'm going to have you cool down for the next 3 to 5 minutes. Within that time frame, I'm just hoping you get back down within 10% of your resting heart rate value. This has 115. And that's the Astrand cycle test. Thanks, Dan.
Thanks, Russ.